For Karen, but Scott, I will say,
Sure.
people who are in the country illegally also can't get Medicaid.
Sure
That's
they
federal
can.
law.
Sure they can.
They can't get Medicaid.
They also
Medicare,
can't register
CHIP,
to vote. They also
Obamacare
can't register to
subsidies.
vote, but we just found one in Maryland who was running the Des Moines school system.
Oh my God, one!
I mean,
Scott.
I'm telling you, you guys say these things can't happen,
I'm
and
just
then they
saying,
happen.
Scott, but I'm
Oh
just
my
saying
God,
it's
you're
federal law.
absurd.
And
You
they're
can
not
run
trying to
cover.
roll
You
back-
can run cover
they're not
for
trying
it if
to
you
roll
want,
back
but they
federal law.
do
No,
get federal
it's
tax
just the
money.
facts.
They get
But Karen,
federal
can I ask
tax
you-
money.
That's Scott Jennings triggering the hacks on CNN by daring to tell the truth. That this shutdown is about Democrats fighting to give illegal aliens free health care while pretending it's all about compassion. Welcome to Nerk News, I'm Nerkish, and if you're looking for the best bits of establishment media without sitting through hours of liberal propaganda, you've come to the right place. Because it looks like Democrats are once again proving that they'll burn down the country to fund handouts for people who broke our laws. I mean, every time they face a policy failure, they double down on ideology instead of fixing the mess they made. How else do you explain shutting down the government for 16 days to protect illegal healthcare loopholes? Here's Scott Jennings calling it out from the start and making the talking heads on CNN panic in the process.
Maybe Republicans will wind up dealing on that, but they're not going to do it under duress, and they're not going to do it under threat of rolling back all the Medicaid reforms that were done this summer. So I think President Trump tried to bring the Democrats in, and at the end of the day, I think the American people know here they're looking at two parties. One's trying to do a bunch of funny business. One's trying to keep the doors open. And right now, I don't think the funny business side is winning in the eyes of the American people.
Well, I just want to correct something. You know, Scott, you know how much I respect you, but let's be honest here.
I don't need to be corrected, and I don't need to be told I'm dishonest, Karen. But by all means, go ahead. We're stunned. I'll just be honest with you. We're stunned. I mean, the Democratic constituencies are principally immigration populations and government workers. This is what your party relies on, and you've closed shop on government in Washington, D.C., and eventually they're going to get tired of it. There is no reason this government cannot be left open.
Americans who voted for Kamala Harris were all immigrants?
No, I'm saying
that's not true.
I'm saying I'm listening to Democratic arguments about most policy issues, and I'm looking at Democratic energy, and it mostly has to do with things to do with immigrants, illegal and some legal, and things to do with government bureaucrats. And right now, you're putting one of your constituencies out of business.
Can I say one thing, which is that people who are in the country illegally cannot get these subsidies that we're talking about?
Sure they can.
No, they can't.
No, they can't. It's federal law, Scott.
Who do you think pays when they go to the emergency room? It's the Medicaid emergency program.
Going to the emergency room is not getting an Obamacare subsidy.
You guys are conflating. You guys are conflating these issues. You're conflating these issues.
And you're being dishonest with
the subsidies are a separate issue. The Medicaid program cuts are a different thing.
Right, but I'm talking about
Medicaid
subsidies.
and the Obamacare stuff are two different issues. And I said the subsidies may get negotiated over time, but what Democrats want to do is roll back what the Republican Medicaid reforms were. They want, look, I don't understand why everybody's so mad. For time immemorial, Democrats have argued that it's good. It's good for illegal immigrants to get Medicaid. Every candidate for president in 2020 raised their hand for it. In the big, beautiful bill debate, they argued it was good policy.
You know, Democrats can't even keep their own story straight. They've been openly promising healthcare for illegals for years, but now they pretend it never happened. Every single 2020 Democrat candidate raised their hand to cover illegals. Jennings is right. The GOP's one big, beautiful bill cut 2.3 million ineligibles, saving $185 billion and lowering premiums. Meanwhile, liberals act like laws magically stop abuse, while ignoring the fact that California spends $12 billion on Medi-Cal for illegals, and New York is dropping $4.3 billion on them. It's absolutely delusional, and Jennings exposed it perfectly. Here's Collins trying the same BS with Speaker Johnson and getting absolutely dismantled for her gaslighting.
So what exactly are you saying that they're trying to do when you talk about giving free health care to them?
I'm so glad you asked. Okay, so when we passed the One Big Beautiful Bill, the Working Families Tax Cut, we had Medicaid reforms in the bill. You and I talked about it on the air. What we did was to eliminate fraud, waste, and abuse. There were a lot of people on the program who were enrolled in the program who were never eligible to be there. Medicaid is intended for eligible U.S. citizens, not illegal aliens, not Also, U.S. citizens who are able-bodied workers, like young men. Premiums are coming down, listen, because 2.3 million ineligible enrollees have been kicked off of Medicaid, which helps to save the program, prop it up. And $185 billion has been saved already.
But you're saying they want to give free health care to people who are in the United States illegally.
That is exactly what the effect will be.
But when I looked at it, there's a little nuance, because they want to undo changes that y'all made, narrowing who is eligible to get that. Those are people who are refugee seekers, asylum seekers. They're not technically people who are here illegally, just cross the border.
No, this is exactly what will happen. And Maxine Waters admitted, I think, accidentally today on the House steps, they want to give health care to everybody.
But Maxine Waters is not in charge. She's not the one. She didn't write this proposal.
She's one of the senior leaders in the House.
And
everybody should Google it and read their counter-proposal
But you see
yourself.
my point, right? You're making this argument that they want to just give health care to everyone who's here illegally. This is not for people who cross the border and don't have paperwork. These are people who have temporary protected status, right?
No, absolutely what will happen if that counter-proposal was enacted is illegal aliens would be paid for. American taxpayers, hard-earned dollars, would be paying for benefits for illegal aliens again. We're not doing that.
But it's against federal law for people who are here illegally to get
health and that's why our reforms are so important to enforce all that. What the important thing to remember is what's happening
I didn't see that the Democratic proposal that people who are here illegally
no,
should get health care.
because they don't have the level of specification that we had in our bill. It will unwind that, and all those things that the CBO just verified will be reversed. We can't afford to do that.
But you see my point, that there's nuance in the argument that you're making, right?
No, that is a red herring in this debate.
You know, Collins keeps insisting it's against the law for illegals to get Medicaid, but laws mean nothing when Democrats carve out loopholes. Johnson flat out called her wrong, and he's right. Emergency Medicaid alone costs taxpayers over $16 billion a year, and federal reports show billions more in fraud and reimbursements tied to illegals. Democrats don't want to fix it. They want to expand it under the false banner of healthcare for everybody. It's an ideological addiction to self-destruction, rewarding lawbreakers while veterans and families wait in line.
Raise your hand if your government plan would provide coverage for undocumented immigrants.
Reimbursements to hospitals, some of which does go to undocumented immigrants using health care there to those hospitals.
The amount of money that actually is going towards people who are undocumented is such a small portion of the Medicaid cuts or the Affordable Care Act.
Support giving illegal immigrants taxpayer-funded health care, yes or no?
We support giving money, support
The answer is yes. You expanded health care access in 2024
Yes, I did.
under Medicaid.
For senior citizens.
Governor, after
and
the
moms with
election,
new babies,
you said,
I would do it all
reclaiming
over
my
again.
time.
You know, Democrats and their media allies have been bragging for years about giving illegals free health care. Then they suddenly pretend it's a Republican conspiracy. CNN panels, DNC debates, AOC, even Kamala and Biden all raised their hands for it on camera. There's no confusion here, just revisionist history. They called it compassion, while hospitals went broke and premiums spiked for citizens. It's the same pattern every time. Virtue signal first, deny later, and send the bill to working Americans. This isn't generosity, it's reckless, and it's proof that the shutdown fight is exactly what Scott Jennings and Mike Johnson said it is. Democrats putting illegals before Americans. But let me know what you think. Are Democrats shutting down the government just to protect illegal health care? Let me know in the comments, and if you enjoyed this video, please give it a like and subscribe to the channel. That stuff really does help us out. Until then, this has been Nerk News. Thanks for watching. Boy.